We've got a quite interesting guest with us today, and we're still busy with Wijnland with lockdown chats. And we have Dr. Marelize Swart with us. She's a PhD in psychology, but her main field is sexuality, and that's for us so important to have a nice talk to her. Because male fertility is a big problem here, and we was wondering how would you see your way forward to help our patients in that specific field. But before we're going to discuss that, will you please introduce yourself to our patients so they know what is your background and why you such interest in sexuality as well?
Yes, well, thank you for that I can be here today. I was really looking forward to come. And the field of male sexuality is, of course, it seems to be a brand new field that there's not that much research. And I'm very excited to hear that you, as a clinic, are going to expand on that. So I studied psychology, and after I finished my master's degree, I registered as a psychologist in South Africa, and then I felt the need to take some time off as a young 20-something girl, and so I went overseas for a few years, and never thought that I was not gonna come back to South Africa, but what was meant to be just a little holiday became 25 years. So I started my career in Canada as a psychologist, and was there for 25 years. And so when I started as a psychologist, I learned that I attracted many sexual issues from people that came to see me, and I realized that I had no idea how to treat these people. And that is where I started I did my PhD. I also did a year in sex therapy at Calgary Medical School. I did another year of further training in couples and individuals and sex therapy in Philadelphia. And so there became my specialty as a sex therapist, sexologist, and I've been doing that ever since.
Great. What is the influence when a couple start to struggle with sexuality on the sexual part? What's the influence on the relationship? How would you handle that, and what kind of problems are you seeing between men and women when they come to see you?
Well, first of all, I want to say that if sex is not a problem, it is 10% of the relationship. But the moment it becomes a problem, it is 90%. And most often you'll find that the couple cannot fix it themselves. They get into a stuck place. Whatever they do, they just can't seem to get out of that stuckness. It becomes a very sensitive issue. It becomes the white elephant in the room. And then at some point I get a phone call, and couples come and see me, and they would also say to me that they've been thinking about coming sometimes for years, but it took so much courage to come because they have got no clue what a sex therapist is and what they do. So I always applaud them when they come in. The type of problems that couples usually face, the biggest one is desire discrepancy, and that is what I see most that comes through my door. You would think it would only be females that struggle with desire discrepancy, but a third of my patients are men that also struggle with desire. And then there's arousal issues. Now arousal, think about arousal. For women, it would be they're struggling to get lubricated, for their body to kick in, and that can lead to painful sexual activity. For men, if they struggle with arousal, here it comes the erection issues. They struggle either getting an erection or maintaining the erection. And then we've got premature ejaculation. Men ejaculate quicker than what they would like to ejaculate. And let's not forget delayed ejaculation, where men struggle with ejaculation and can take up to half an hour, and sometimes not at all, especially during sexual activity with their partner. They might be able to do it by themselves, but not with their partner. And again, the pain can be with men as well. Men and women can have pain, full sexual effect on their sex life.
What I learned from psychology those days is like there's different forms of intimacy. You know, you can have intellectual intimacy or emotional intimacy, but sexual intimacy is such an important part of a relationship. I always say it's like a cherry on the cake. It's the thing that we needed to be there. And it's also different meaning for women and men. For women, it's sometimes you can get your head around and you can do it like in our field with the fertility, it's about baby making process.
Right.
But on the other side, for the guys, they needed, as you said, the desire and the arousal phase. And if you start to use sexual intimacy for baby making process, what happened to the guys? They will withdraw and they struggle, because as soon as you put them on this hard spot that they needed to do it every day or on time, then they won't be able to do it. And I think that's why we concentrate so much here on the male fertility, because it's a fast growing one here. And as soon as the diagnosis comes of male fertility, you know, that my sperm count is not so good, what do you think psychological happened with the guys, and how can we help them to get around that it's not, if the diagnosis of fertility is there, it's not something to do with the sexual but psychological part of the men as well.
Yeah, I think you've just now put your finger on a raw nerve here for men. I would think that most men would not think that it would be them that have issues with fertility. Most of the time we think it's women. And then when the doctor they do the tests and they would say it is the man, it is, I don't even have a word to say the devastation that the men they go through, because for men it's about virility, it is about their identity, it's about being masculine. So all of those things are now being questioned, and then it affects the sexual functioning. Men struggle with erections, they struggle with maintaining the erection, suddenly you might find that they struggle with premature ejaculation. And if you are going to expect a sexual experience that is not going to end well, then they shy away from wanting to do it, so they start losing their desire. And now we've got a situation where it has to be tonight at 6 o'clock. They become like the stud on demand, and they know they've got to step up to the plate. The pressure is immense with performance anxiety, and then often the moment the performance anxiety takes a place in your head, things just start unraveling, and you suddenly there's all sorts of things that go wrong, and they feel terrible. So it has a huge effect on sexual functioning and the relationship, of course.
Is there any advice with your infertility couple where there's male fertility that you can give the guys, or do you want to see them as soon as possible when they do struggle? I think the biggest thing is guys don't want to talk about it, they don't want to open up it. How can we make it easier for them, and what advice can you give couple to convince to come and see you as well?
You know, I would really advise people to come and see. Look, I see myself as a psychologist and a sexologist as soon as people get on board, because they already have had a 6 months or a year where they've been trying to get pregnant, and I see these people in my office. In that 6 months or a year, the sexual dysfunctions has already started to get a life of its own. And just to see that there's a few skills that I can help them with, to be proactive before the treatment almost starts, to help them with the performance anxiety, to normalize how they feel, and to help with the couple's relationship, and also to you know, the woman is very much part of the solution here, and if she's going to be very critical of the male sexual functioning,
and the pressure on.
Oh, it is. It's it's not the thing to do, is to be critical in that time, because it just makes the performance so much more prone not to be a failure. So
is there how many sexual intercourses during the month? I've seen recently that the younger people to have, it's just the experience, it's not significant, I don't have studies to show it, but that people out there have less sexual intercourse to compare to in the old days. Is there an average of normal activities? Would you say that's an average, or is there nothing like that? It depends from relationship to relationship. Or
are you talking about an average for people that want to get pregnant, or in general?
For a normal sexual health relationship, what is there any average, or does it depends from couple to couple? Or
yeah, of course it you know, some people have it 3 times a day, and some people might have it once a year. So I always say to people, I would go to the US statistics, and they would say once a week, once in 12 days or so, and then there's actually recent research that shows even if you have sex more than once a week, it doesn't actually increase sexual happiness, because maybe the woman, I'm just using the woman as the example here, maybe she's happy with once a week, and if she's going to be pressured to feel she has to do it 3 or 4 or 5 times, she's not going to be happy. So very interesting research to say that to be sexual once a week and to do it more doesn't necessarily mean greater happiness.
Okay. Yes, Marlies, it's quite interesting to hear all these kind of information, and with male fertility that's growing, as I said, 50% of our couple is male fertility. We recently see more of sexual dysfunctional habits in our practice, and I'm unfortunately so lucky to have you, and you're going to work with us more and more. For guys out there, we've got an expert here to help you. Don't be ashamed of these problems, because we do have solutions for that. And yes, if you do sexual therapy, it's a long-term thing, or it depends on again case to case, or any advice or comment on that people out know what it's all about?
Yeah, that's a great question. Sex therapy is often short-term brief therapy, and I give homework assignments for people to do at home, and also help couples to just to connect again, because if we don't start with a couple relationship, to do sex therapy by itself, it's not going to work, because by the time I get to see the couple, they're quite disconnected, and that's the first place to start, to let them you know, have a better connection. And I often take sex off the table and replace that with more sensual touching, just to get the performance anxiety, to take care of that as well for the short term. So there is quite a bit of structured exercises.
In the process, there are more emotional connection in the beginning, and then the rest will follow.
That's right.
Yeah, and again, it's fantastic to hear it, because we also know from our practice that 1 out of 2 of our marriages is not making it when they try to use the sexual intercourse for the baby making process. And again here, wonderful that Marlize is going to work with us, and she will be available for all our patients here. And please make contact with us. We will put up her details as well, but we also will facilitate her consultation here. And just to end it off, I know Marlize from a little girl. We were singing together in the Tigerberg Children Choir, so it's really a pleasure to work with you. And yeah, thank you for coming to see us.
Thank you so much, Lizanne.